My name is Bibbi Stokes. I'm a field reimbursement manager for Cencora. I'm a nurse by trade, and I think that I've always been a helper. I was a medical care coordinator for a very large health system. I do prior authorizations. I did all the denials we had over 1,000 patients. Every denial came to me. I quite enjoyed appealing denials. A friend told me that I should be a field reimbursement manager. And when he was explaining it to me, I said, well, how is that a job? That's what I do every day. And he said, well, I know, that's why you should be a field reimbursement manager. So later I started to look into the role. On a great day, a patient goes to the doctor, they get treated, they get a prescription, they go to the pharmacy, they fill the prescription, they start the treatment. But also what happens a lot is a patient goes to the doctor and they need a treatment and they're not able to get the treatment. The insurance carrier, it's new to them. They don't think it's necessary. A pharmacy has to go back and forth between the provider and the patient to make sure the coverages are correct and the verbiage is correct and the prior authorization has been done. That happens often. And that's where an FRM is essential, because we are the liaison between that patient, the provider, the pharmacy, and the payer. Every week, I like to call all of my new prescribers, introduce myself, introduce the role and what an FRM does, how we assist with access, information. I also call my offices who have maybe a lot of prescriptions still pending at the pharmacy to see if there's anything that I can offer to help get those fulfilled. I meet with my team, just talk about what's going on in the field. And I also give each of my salespeople about 25-30 minutes every week so that we can talk about how we can partner to help providers reach a higher fulfillment rate. And then at the end of the week, I make sure that I do a full report of all the contacts that I've interacted with during the week and what was the resolution. Providers get frustrated with denials. Their time is of the essence. They're getting frustrated, especially if they get a denial, and they don't know what to do. Most of the time, I'm educating on the insurance process and how things work, because it could be the provider or it could be the provider staff member. A lot of times they just don't understand how the payer system works. And when you can do a prior authorization and use a certain verbiage and get a denial, and then you use that same verbiage for the appeal, and it's because one person looks at the prior authorization, but another person is looking at the appeal. So the verbiage could be right, you just have to submit it 2 times. So we look at processes to help providers and their staff overcome the frustrations of prior authorization process, and especially the denials. If we have providers that see patients, they do their own prior authorizations, they write their own scripts, they do a lot. And if a provider does that and they have questions, well, they can't ask me between 9 and 5 because they're seeing patients. I have to put myself in the patient's shoes. If I was a patient, when you're in that waiting room, you're waiting. You want your doctor to see you. So it's okay if they call me after hours and we can discuss what's going on, what's pertinent to a specific patient or just their policy or process. So I think that they appreciate that a lot. Manufacturers need to understand that the FRM role is essential. It's essential for patient access. It's essential for provider education. It's essential for helping them navigate the payer process. It's essential to get their medication in the patient's hands so that they can see how well it works. At the end of the day, their objective is to help people, and that's what the FRM does.